Hi, I'm Amy Campbell. I work for the Kansas Mental Health Coalition. I'm really pleased to be able to be with you all today, even if it is only virtually. NAMI is a huge part of our Kansas Mental Health Coalition. We would not be able to be successful without them. So, congratulations on being a member of this incredible organization. I wanted to visit with you for just a minute about the coalition. We're a statewide organization. We are a roundtable that meets once a month to share information with one another and to develop consensus recommendations that we take to the State House to improve Kansas mental health policy and statutes. We do that through our annual Advocacy Day at the Capitol. I know many of you have joined us in the past. I hope you all will put March 7th, 2023 on the calendar and join us again next year. We present public testimony at hearings. We do grassroots outreach to legislators and other policymakers, and we also conduct education events, a lot like your own NAMI organization. This year, there were a number of huge things that were passed by the 2022 legislature. I'd like to talk to you for just a minute about that. The 988 mental health crisis hotline legislation was huge. It was one of the last things passed by the Kansas legislature, and that would not have happened without the advocacy of many of your own members and the leadership of the folks in your state NAMI office. Thank goodness for all of the work of Sherry Vaughn and Ryan Reza that helped us push this Senate Bill 19 across the finish line. We have a lot that we will need to continue to do to seek sustainable funding for this hotline, but it was really great that Kansas is one of the few states who actually passed legislation this year. Additionally, Kansas has adopted something called CCBHCs. That is a new structure for community mental health centers where they can be certified as certified community behavioral health centers. Those centers must provide comprehensive behavioral health services while also focusing on physical health and whole person wellness. We have a state-based opportunity for this certification, and there are other states that are actually passing this legislation following Kansas's lead. There were 9 centers certified as of July 1 this year, and there should be 9 again planned for next year. We recently heard that the federal government has also issued 13 federal planning grants for centers to do the work that it will take to become certified. Why does this matter to us? It's because CCBHCs offer a wide array of evidence-based services, including mobile crisis response, screening and risk assessment for primary care needs and addiction needs, and access to care with reduced wait times regardless of the ability to pay. They offer some veteran services, expanded care coordination, and they have a commitment to peers and family because that involvement is essential to recovery. There is much more information to be found on the internet about this, but please reach out if you have other questions. We got a Medicaid reimbursement rate increase this year of 4%. That doesn't cover the rate of inflation, but it sure is a start. We will be advocating for a 10% increase in 2023. The legislature also expanded the K-12 mental health pilot program. That program has shown amazing outcomes by placing facilitators into the school buildings and linking mental health services with kids and families in the schools rather than forcing them to leave school to seek services elsewhere. You know, there's a lot still to be done. Governor Kelly did end the state hospital moratorium on voluntary admissions, which was a great thing, but she recommended additional funding for new hospital capacity and improved wages. The legislature did approve the higher pay for state hospital employees and added public-private partnerships for community hospitals and treatment centers, funding for this to provide alternative to state hospitals. They also passed legislation that allows community-based competency and restoration so that individuals don't have to wait in jails for quite as long, waiting for those services. There is an interim committee meeting right now to consider the further recommendation for the added beds, but also they are looking at how to build our mental health workforce across the state. Most importantly, KDADS and Kansas is really investing in alternative community-based treatment options to avoid hospitalization altogether. We do have a workforce crisis in Kansas. All states are experiencing this. Many Kansans are unable to access care when they need it because of this workforce shortage. There are beds that are unused. There are buildings that are shuttered. Center directors tell us that crisis programs and their housing programs are having a very difficult time finding staff. So we really want Kansas to look at improving workforce by increasing wages and benefits, increasing reimbursement for services, hiring and training more peer workers and funding those peer programs, and creating a career education pipeline to interest young people in the field, in addition to offering scholarships and student loan reimbursement programs. We continue to work on mental health parity. Parity insurance coverage is federal and state law, but policyholders often have to fight for insurance approval to get the behavioral health treatment and medications that they need. So that will be ongoing work. Expanding Medicaid is still on the table. It's something we really care about, and we hope you do too. At the end of the day, it's all about working with folks like you and really talking to families and individuals who have experience with mental illness to learn what has worked for them and how we can get those services more available across Kansas, and also to build the resilience and the improve advocacy skills among the people and citizens of Kansas themselves, because they are the best people to tell their own stories and to advocate for what they need. So thank you for the time. I'm sorry I'm not there with you in person, but I sure hope that I can be next year.